What if our next doctor isn't human? What if the person diagnosing your chest pain, analyzing your MRI, or prescribing your medication is an algorithm? No waiting rooms, no rushed appointments, no human bias, just data, just precision, just AI. But here's the real question. Would you trust it with your life? Welcome back to Tech News. I'm your host, Karthik, and today we're diving into one of the most fascinating and controversial questions of our times. Are AI doctors replacing human physicians in tomorrow's healthcare? And by the end of this episode, you might completely rethink about going to the doctor even means. Let's start with reality. AI is already in hospitals. It's already diagnosing diseases. In some cases, it's outperforming humans. AI system today can detect cancer in radiology scans with stunning accuracy, predict heart attacks before symptoms are even shown, analyze millions of patients' records in seconds, and recommend treatment plans based on global data. Unlike human doctors, AI doesn't get tired, doesn't forget, doesn't have bad days, or doesn't rush appointments. Imagine a system trained on millions of MRIs worldwide. It recognizes patterns no single human could ever see in lifetime. That's not science fiction. That's happening right now. But here's where it gets intense. If AI becomes better, faster, and cheaper, what happens to doctors? Let's talk about advantages. Number one, speed. AI can scan through thousands of images in minutes. Human radiologists, maybe dozen per day. Number two, accuracy. Some AI systems detect early stage cancers that human eye misses. Number three, what about rural areas? What about developing countries with doctors shortage? AI doesn't need sleep. AI doesn't need relocation. AI can scan globally. Imagine a remote village using AI diagnostics through a smartphone, a wearable device predicting disease before symptoms appear, a 24 by 7 AI physician answering your health questions instantly. That could save millions of lives. But is medicine only about diagnosis? Let me ask you something. When you're scared, when you have just heard it might be cancer, when your child is sick, do you want a screen or do you want a human being? Medicine isn't just science, it's empathy, eye contact, and it's reassurance. AI can process data, but can it comfort a grieving family? Feel urgency beyond numbers? Human doctors do more than diagnosis. They interpret emotions and build trust and saves lives too. Now, here's the real twist. History shows technology doesn't always replace, it transforms. ATMs did not eliminate bankers. Autopilots didn't eliminate pilots. So, what if AI doesn't replace doctors, but upgrades them? Imagine this model. AI handles data analysis, imaging, predictive modeling. How about human doctors? How can they handle it? Well, they can make decision, ethical judgment, patient communication, and complex cases. Doctors become faster, more informed, less burned out, more available to connect with patients. That's powerful. But wait, this is tech news. We have to ask hard questions. What about data privacy? Your entire medical history is in the cloud. What about bias in algorithm? If AI is trained on limited data, it could be a misdiagnosed on certain populations. Who's liable if AI makes a fatal mistakes? Is it the hospital, the developer, the government? And here's the most chilling one. What if insurance companies prefer AI because it's cheaper and slowly phases out human physicians? It becomes cost efficiency versus human compassion. That's the real battle. Let's fast forward 10 to 20 years later. You walk into a clinic, an AI scans your face, analyzes your voice, checks wearable data, and diagnoses you in 30 seconds. Human doctor reviews and confirms. Or personal AI health companion on your phone that tracks your biology 24 by 7. Which future sounds exciting and which sounds terrifying? Drop your answers in the comments. I really want to hear from you. Here's my question to you. Are AI doctors replacing human physicians? Here's my final take. AI will become the most powerful medical tool in history, but medicines without humanity is incomplete. The future isn't AI versus doctors. It's AI plus doctors. The stethoscope didn't replace doctors. The MRI didn't replace doctors. AI won't either. But the doctors who refuses to use AI, they might be replaced by those who do. And that's the real revolution. If this episode made you to think differently about healthcare's future, hit the like button. Subscribe to my YouTube channel and Spotify Tech News, and follow me on Facebook page Tech News for more deep dive into technologies shaping tomorrow. And share this episode with someone in healthcare, because this conversation is just getting started. Until next time, stay curious, stay informed, and keep innovating.